All right, this is proven and it's on pain, overcoming pain. These are like teasers with experts with little tidbits, but you really got get into the details and see professionals. So here goes. Pain.
Hi, and welcome back to Proven, Healing Breakthroughs Backed by Science. I'm Nick Palizzi, and in this next episode, we're going to be exploring a 4-letter word that affects far too many of us: pain. Did you know that roughly 1 in 4 adults in the Western world suffers from some form of pain on a daily basis? It isn't a new thing. We've been feeling pain since the beginning of our existence. It's a natural part of who we are. And believe it or not, pain is your friend. Without it, you'd leave your hand on a hot stove without ever realizing that you were hurting yourself. You'd walk on that sprained ankle without ever knowing that you were causing more damage to the underlying muscle and tendons. Pain is there to let us know when things are wrong, to protect us. But once it's done its job of alerting us to what's there, there's no benefit from pain signals anymore. In fact, these signals can start to ruin our life if they're not managed properly. So how do we work through chronic and even acute pain safely and effectively? Well, the science is in, and there are some remarkable techniques and therapies that we all need to know about. Are you ready? Let's go.
What is pain? That's a really good question because pain is so complicated. There is one school of thought, now that they can measure things in the brain, that says all pain is in your brain. Well, no. You perceive pain in your brain. Pain is registered in the sensory cortex and the pain centers in the thalamus. So in order for the thalamus to get this signal about the fact that a tiger bit you in the leg, right, there has to be a pain nerve down there. Also, there's a vagus nerve down there in the blood vessels. And all that information goes screaming up to the brain. There are what's called pain nerves called nociceptors that are everywhere. They keep you alive. Pain is important to survival, right?
If you're moving a joint that's sore, if you're moving a joint that's hurting, a joint that's swollen, and then the body tells you don't move that joint.
What if you went cross-country skiing and you tore your medial meniscus? So that's a peripheral pain generator. There are genes in that area locally that turn on, so the cell starts making inflammatory products. Those are local. The inflammation has a local effect on the knee, the bone, the cartilage, the nerves, and that local pain is indeed conveyed up to the brain, and that's why you limp. And you limp without even thinking about it. You don't have to think about it. Cerebellum's got it. It's like, it's all right, don't you worry about it. I can keep this knee safe. And you limp in a very particular way. You are going to limp different if your knee is injured than if your hip is injured. You don't do that. Your cerebellum does that. That all happens here in the brain. You need a very active immune system to heal this injury. So the thalamus turns the vagus off. So you notice that for a couple, 3 days after you tore up your knee, your digestion's not so good and you aren't that hungry. It's all coordinated. The vagus stops controlling your immune system. So this knee can get inflamed in the size of a grapefruit because the vagus isn't telling the immune system to chill out. It's fine. It is not fine. We're going to die. My knee is hurt. So it's a communication and coordination process that is completely out of your control. When the inflammation goes down here, the brain gets, oh, it's better. That is a normal pain response. The place people get tangled up is when pain becomes chronic.
So when you have chronic pain, the brain is like on high alert. And that means even if you touch hairs on your hands, the brain perceives that as a threat and perceives that as pain, even though it's not a pain signal. And I call it chronic pain brain. So when the brain is flooded with pain signals from the periphery on a regular basis, they change your alertness levels, they create brain fog and so on. Those are all effects of chronic pain for the brain.
You can amplify pain in your brain, if the thalamus gets so much pain for so long, the thalamus actually changes its job from pain suppression to pain amplification.
So you can not only treat the periphery, treating the brain becomes an important part of the treatment process, not just treating yourself where your pain is, but treating the memory of it. And if you suppress the pain signal in the brain's recollection of it, then you decrease the pain in general in that body. Because chronic pain brain also causes sensitization. So what you want to do is quiet down the brain, heal the periphery as well. You try to take care of the tissue at the cause as much as you can as well.
The truth of the matter is that your immune system regulates pretty much how much pain you're going to have. So it is a truism in medicine that you can have two patients that walk in with exactly the same x-rays. The x-rays of their low back are horrible. This guy's out playing golf 3 days a week and wonders, can he have an Advil? This guy is asking for lumbar spine surgery. He is inflamed. He doesn't sleep. His pain is really bothersome. And that's where the pain system becomes important to understand. Different people handle these signals differently.
Why is it that some people, let's say you can have 20 people that each have some kind of injury to their shoulder, and a certain number of them will go through a typical healing process, and eventually it gets better after a few months or whatever it is. And other people, it never gets better.
Hello. All right, back with pain.
It just keeps lingering.
Medicine has taken it a skeptical step too far by saying this guy's faking it. No, this guy's immune system is sensitized. It is an interwoven system, and it's different in acute pain versus chronic pain. It's absolutely fascinating.
All right, the first of our 5 alternative solutions is a breakthrough known as frequency-specific microcurrent, or FSM. It's technically been around for over 2 decades, but it's now becoming a go-to treatment for pain and the underlying issues that cause it. FSM falls under the category of electromedicine. And after this next segment, I think you'll understand why this new realm of healing is quickly being embraced by health practitioners around the world.
So microcurrent therapy is used, what it basically is, it's very low-level electrical currents in the millionth of an amp range. The 1960s, they started making things called TENS units, transcutaneous electric nerve stimulation, which is very crude compared to microcurrent, but it had a certain amount of pain-blocking effect.
There is a difference between devices that just turn off pain, like spinal cord stimulators and TENS units. Microcurrent works differently. It is approved in the category of TENS devices as a matter of regulatory convenience only.
So microcurrent, which was actually developed in Germany by Dr. Reinhold Fohl and some other colleagues, was a much lower current that's much more precise in how it's used. Like you can put pad electrodes and apply microcurrent, say, to the whole arm or the whole lower back or to the head or to the knees. And so that's one way it's done. And then it can also be put on to specific acupuncture points, which is my specialty. That's what I develop with my equipment. And so I call that microcurrent electroacupuncture, which would be, the specificity of doing it that way. Now, Carolyn McMakin, who's a pioneer in the field of microcurrent, she connected with some naturopathic doctors that had come up with charts of frequencies, kind of like a map to the frequencies of the body. So like which frequencies reduce inflammation or congestion, or which ones get the lymphatic system moving, or which ones are good for tapping into, say, the amygdala of the brain and reducing PTSD symptoms. So they kind of mapped out which frequencies do what. And then she pioneered applying that through microcurrent equipment and has been teaching that all over the world and very effectively. So that's called FSM, or frequency-specific microcurrent.
So frequency-specific microcurrent, the combination of the microcurrent and the frequencies treat the cause of the pain. So if you have inflammation in the facet joints, the posterior joints in your low back, the only way to treat low back pain with frequency-specific microcurrent is to run the frequencies to reduce inflammation in the tissues of those posterior joints. Inflammation in the cartilage, the bone, the periosteum, that pain-sensitive lining of the bone, the ligaments, the tendons, the nerves, the dura. It treats the cause of the pain. And when it doesn't work, it's because you missed something. The whole myofascial community really wanted myofascial pain to be a muscle disease, something wrong with the muscles. We don't treat the muscle. We treat the underlying cause. Sometimes it's discs, facets, the nerve. You are gluten sensitive and you had a sandwich for lunch. The inflammation in your small intestine caused by the food you ate feeds back into the spinal cord, irritates those nerves. Those nerves make the muscles in your abdomen tight, and you show up 3 days later or 2 days later with trigger points in your rectus abdominis that cause low back pain. Your complaint is low back pain. What they have to treat is the small intestine. For us, it's like, yeah, muscles of collateral damage. Treat small intestine for inflammation, allergy reaction, have a come-to-Jesus conversation with the person who ate the sandwich, and the low back pain gets better. Muscle pain goes away. Like literally, the knots just disappear. So we use it post-operatively. So after facial plastic surgery, which normally leaves them pretty beat up looking, they don't bruise. Hip replacements, post-op hip surgeries, jaw surgery. I had a jaw infection from root canals. And I tell people casually, yeah, I've had 9 jaw surgeries. And they're like, oh, how horrible. It's like, nah. Put the sticky pads here, put the sticky pads there, you run the machine, doesn't bruise, doesn't swell. Maybe you take 2 Advil, and that's it. December 19th of 2004, on a Monday morning, I get a phone call, and it is Buddy Prim, who is Terrell Owens' private trainer. And he said, Terrell was hurt yesterday, and he wants to play in the Super Bowl in 6 weeks. And his chiropractor, who does FSM, said he's not going to do it. It's going to have to be you. Can it be done? I said, well, the injury was he had an open spiral fracture in the fibula. The tough membrane that holds the tibia and the fibula together was shredded. Nothing was holding those 2 bones together. And the ligaments that hold basically your foot onto the bones, those were shredded. And he was having surgery on Tuesday morning. And I said, well, they've already been treating the fracture, but I have to be there when he gets out of the surgery. Got on a plane, treated him in the car on the way home from the surgery. I put sticky pads on him and started treating him to stop the bleeding, reduce the inflammation, stop the bleeding, repair the torn tissue, treated him all the way home. That was an hour, and it was 10 o'clock in the morning, and I treated him until 10 o'clock the next day. I slept sitting up, and I'd wake up as you do every hour or two, punch a button, go back to sleep, treat the bleeding, treat the inflammation, treat the torn and broken, treat the fracture. And at 10 o'clock Wednesday morning, the team trainer came in. His name's Rick Burkholder. Took the Velcro off the boot, got some bandage scissors, cut the gauze, and opened it up. It was 0 bruising, 0 bruising, 0 swelling. There was so little swelling that you could see the plate and the Phillips head screws that they had used to hold the 2 bones together. This guy has 6%, 8% body fat. And Burkholder said, he's very restrained. How do I take advantage of what you can do? And I said, well, you're going to have to believe what you see, because I've never done anything like this before. So I treated him another probably 14 hours that day. And then I think it was Christmas Eve, so I treated him morning and flew home Christmas Eve. Burkholder, on the 26th, had him running in a swimming pool, 3 feet of water with a Ziploc baggie on his leg, an hour a day, to take the gravity off of it. Think about it. He had not only to be repaired, he had to be physically fit to play in the Super Bowl. He's a wide receiver. He sprints. I came back the following Monday. He and his girlfriend are playing tag and throwing snowballs in sneakers in 3 inches of snow 1 week after a career-ending injury. So I treated him 3 to 5 hours a day, 5 days a week, for 5 weeks. At the end of 4 weeks, everybody will remember the surgeon was running around telling anybody with a microphone or a pen that this was a career-ending injury. It was at least 18 weeks or a year and a half, and he was being stupid and blah, blah, blah. And he wouldn't clear Terrell to play, to weight bear in practice. Mr. Burkholder had a different idea. So he said, I'll get him cleared. So he took a fluoroscopy, it's a moving picture x-ray, and showed that the ankle was completely stable. The ligaments were completely healed. The fracture, an open spiral fracture, was healed bone to bone in 4 weeks. That's not possible. And Burkholder said, yep, he can practice. So they did. I mean, the trainers were brilliant. He had him playing video games with his feet to get the proprioception back. And then got to the Super Bowl. He got there Tuesday, and he couldn't run. I got there Wednesday. His massage therapist, Brian Glotzbach, and I put him on a massage table in the bowels of the stadium at the Super Bowl. And I ran the frequencies, and Brian has fingers like steel. And we took apart the scar tissue in his leg down to the bone, 5 hours. The frequencies resonate with the bonds that hold the scar tissue together. So you wait for it to soften, and then you just blow right through it with your finger. And it goes all the way down. Brian still describes it as bloodless surgery. It was crazy. And then his chiropractor came on Thursday and adjusted the ankle. Played on Sunday like he'd never been hurt. 157 yards. If they'd won the game, somebody might know about FSM having done that. But the quarterback kept getting sacked, and he really hates getting sacked, and he really hates the snow. So we lost. What we did with Terrell Owens is still impossible.
Okay, so we just heard about a very
I got to stop right there. This is just mind-blowing. Mind-blowing.
important healing technology that most of us don't know about. I sure didn't until we created this series. Now we're going to dive into another technological breakthrough, which, like FSM, has been around for decades, but is only now beginning to become a standard complementary treatment for everything from brain trauma to incontinence to, you guessed it, pain. It's called biofeedback, which is essentially tracking a specific function in the body to measure how well it's doing, and then learning how to train that function in real time so it and your quality of life improves.
I'm going to stop here for a moment and think about what's going on here. This is just mind-blowing. We're getting closer and closer to learning how energy, very control energy levels through these frequencies are helping heal the body. And a time's going to come when we can do this with quantum computers and really do some miraculous stuff.
Think of a Fitbit and then imagine that same idea, but for a variety of other functions your body performs. You'll hear about different types of biofeedback in other episodes, but for the purposes of this one, let's find out what biofeedback can do for pain.
Okay, we're going to end it here. We'll come back with biofeedback and pain. But these low frequencies to heal tissue and movement and whatnot, this football player is just phenomenal. This gal that's pioneering it is just phenomenal. Mind-blowing.